you ever voiced across any sort of discomfort that you may have experienced, whether that be through racial hostility or community organized situations, to where, because of the color of your skin and the barrier in which people are aware, have caused great divisions through historical research, when you would immediately assume the best course of action is to find sympathy and support for such a related need, when in reality that sympathy and that support is absent. Contrary to what they have taught you about their support team, it is absent, and it has been absent since the decades that built the foundations and the constitutions of this law. And this place, being within the Western Hemisphere, has done a great job at using health more as a weapon, as an economy, rather than a place full of sincere, compassionate, and caring people. I would say as a collective, not particularly any specified individuals, but the agenda as a collective became nothing more than to immediately catch as many people as they can, to market their pharmaceuticals, and to raise the equity of their multi-billion-dollar industries and funders and private donators who all profit the moment somebody is given a label under their jurisdiction and their concern. And given this becoming the situation, there remains nothing more than a trap, to where the baseline issues related to the people who have been subject to these institutions have become vulnerable, and have unfortunately remained unsolved, related to any pressing matters that may have hindered or initialized the health procedure in the first place. And furthermore, there is a great deal of hostility, should I say, even that would be a understatement, which goes on within these institutions to deliberately try and waive any sort of accountability on their end, due to their failure to bridge the gaps which some of these diagnoses and some of these situations have been created by the same system that they have been using for years, since the civil wars, since the world wars, in which these institutions have actually subject many people to take the authority of the care provider, or to be subject to anything that somebody who is proposing that they are a support to you, simply because they carry the label doctor, not knowing that these people, and I'm not going to say all of them, I will refer to the publicly funded ones, some of them, actually I would say most of them, these people are nothing more, no different from your typical 9-to-5 employee working at the gas station, with no disrespect, but in the sense that they do not take your problem into priority. They clocking in their job at 9. They inform you everything that is wrong with you and everything that is right with them, because they hold the label doctor. They give you one of these multi-billion-dollar funded prescriptions, which has been a great business for the Western Hemisphere. and they convince you to use that business for life. And once 5 o'clock hits, the window for you to access your supposed support provider or care provider, it vanishes. Your ability is hindered. You will not have anything to say or do should you run into any problems outside of that barrier. It's a temporary solution for what they propose is a permanent problem. And despite being a permanent problem, they go home, they clock their Netflix, and they kick their legs back because they have just been paid to institutionalize you and to convince you that you are absolutely incapable in from the perspective of the Western world of actually functioning off of any sort of decency or self-regulated behavior. You tell me what kind of decency that is to squeeze somebody everything in their life into one label, to refuse to actually listen to the individual who has been tricked into believing that you are of help. And should you have been of help, I believe that a lot of the issues as we see would be resolved today. But what you will see through statistics and data, the cases of mental health have been skyrocketing, and they are only increasing. They are not getting better. And these public authorities have the audacity to still inflict their judgment and still inflict their same typical old school way of attempting to solve the problem by attempting to remove the memory and the experience of the individual and conforming them under a label. And if you look in the reports and the statistics of the rising cases, the situation is only getting worse and worse, while the pharmaceuticals are profiting off of these people. And sadly, there is no kind of remedy for those who are actually undergoing a proper situation in where their livelihood and their personal goals and ambitions can be achieved. As far as these doctors have told, they have spewed everything out of pure ego to try and prove themselves as the label which the government gave them, being the doctoral label, thinking that they are perfect, incapable of doing any injustice, when there have been several reports that have actually shown you that the same thing these patients who go to these doctors have been doing. These doctors have been very capable of and actually very responsible of exhibiting the same behavior by themselves. Anger, frustration, lack of patience, all of these regular human emotions which just need regular human solutions, beyond claiming that your status as doctor gives you the authority to tell somebody everything that's wrong with them when they are within their well-grounded right mind, as long as they are not causing any harm to anybody, to exhibit these emotions, as these emotions exist within the regular state of biological cycle, and it is with their jurisdiction that they put an emotional cap on how much they believe people can tolerate, despite the fact that these doctors have been covertly responsible for some of the greatest deals of harassment in history. Michael Jackson, for instance, was taken from his own will because of his doctor who covertly took money in order to try and help him solve a problem. I'll leave it at that. Furthermore, there have been several cases of doctoral misconduct to where doctors have been called out for actually perhaps forcing people to conform under their control, because that's all they really want. It's control. And as soon as you realize that you have a mouth and you have a right to speak out, I believe this control can come to a halt. And that is the best way it's going to solve.